Dr. Alieta Eck, MD, graduated from Rutgers College of Pharmacy in New Jersey and the St. Louis School of Medicine in St. Louis. She studied internal medicine at Robert Wood Johnson University Hospital in New Brunswick and has been in private practice with her husband, Dr. John Eck, MD, in Piscataway, New Jersey since 1988. Thanks very much for being with us, Dr. Eck.
Thank you very much. I appreciate being able to come here and tell of my experience, and I think I can give some really good advice as to what we could do to reduce the emergency room costs and reduce the overall cost of medicine in the entire United States. I've been in private practice for 23 years. I was involved in the Medicaid program early on, but then got out when I realized that I was losing money with every Medicaid patient. That wouldn't last very long if I kept going. So my husband and I started a free clinic 10 miles away in a church grounds. A little building had been flooded, and it got renovated by volunteers. We started it with debt-free. We have volunteer physicians, nurses, support staff. Everybody volunteers. Nobody gets paid, and they love to be there. We see about 300 to 400 people per month. We only are open 12 hours a week. So it's a huge, efficient way to take care of people who just come in. They see smiling faces. Everybody's happy to see them. They're there because they're volunteers, and we provide good primary care. I looked at the little script in the beginning where it says that it's $1,000 to take care of a patient in an emergency room, and it's about $140 to take care of a patient in a federally qualified clinic, and that's by the testimony of somebody who works in one or who runs one in the next town over. It costs us $13 to take care of a visitor. And with all the volunteers there, people come for very, very different reasons. People are poor for very different reasons. And a lot of them have made social decisions that are not in their best interest. They've gotten involved with drugs or alcohol. They're single parents. Just things are difficult. So to have somebody alongside that can come and help them with those type of issues, which is the case in a church environment, is huge. And our church has gone from 150 to 2,000 members in the 7 years since we've had our free clinic, because people are really want to be in a community that cares. People want to give in a community that cares. The receivers and the recipient and the givers of the care are ennobled by true charity. I was looking at the Form 990. I was trying to figure out what it is with these federally qualified clinics that makes them different than us and why it costs so much to take care of people there. It seems like it should be a lot cheaper. And I looked at Form 990. They pay $113,000 for travel, $650,000 for provision for bad debts, personnel recruitment, $265,000 a year. They get money from Medicaid. They get money from the federal government, grants. They get uncompensated care payments. Their miscellaneous income is twice the income of our little clinic, which is $58,000 a year. Is what all it costs for us to take care of these people and do a very good job. All of that got me thinking, and I said, Medicaid is $10 billion of a $28 billion budget in New Jersey. And I thought, what could we do to reduce the cost? It's really hurting the taxpayers. The taxpayers are reeling at the expense the government is putting on them. So if we could reduce taxes, that would help the whole economy. And we came up with the idea, several of us came up with the idea of what we call it the Volunteer Physicians Protection Act. We need more physicians. It's hard to find physicians to volunteer. They're very strapped by decreasing payments from third parties and by increasing regulations. So we thought, why don't we have physicians donate 4 hours a week in a non-government free clinic dotted throughout the state? And then the only thing we would ask the state to do is to extend the medical malpractice coverage that they give to the physicians who work in the medical schools. Just extend it to those physicians as their only reward for doing that time, for putting in 4 hours a week in a free clinic. The free clinic could be located within the hospital. So the hospital, when they see a patient coming with a sore throat, they could be going over to this free clinic, which should be just a couple rooms down. And the physician who's volunteering could be taking care of that patient for free at no cost to anybody, to the taxpayer. That way, we could take care of the poor, the taxpayer would not be impoverished by the system, and we could balance a budget. In fact, I ran some of the numbers. We only were up in 12 hours a week. I figure about maybe 100 patients a month we are diverting from the emergency room. They're coming in with their sore throats, with their earaches, and sore throats are the #1 reason Medicaid people go to the ER. We're diverting them. And if we were open 72 hours a week, that would be 600 patients. If there were 100, that would be 60,000 ER visits we could be diverting. And I'm just doing the math, which might be wild, but $720 million we could save in New Jersey just by doing something like this, where instead of spending $1,000 in the emergency room, we spend zero cost to the taxpayers, a lot less cost to the donors, and I think we would solve the problem.
Thank you very much, Dr. Eck. I asked Dr. Eck a question. First of all, thank you very much for what you do. Your volunteer activities are much appreciated. Let me ask you this, in a sense, philosophical question. We've gone a little bit into philosophy today. I believe, many people in my own state believe, that health care is a right, R-I-G-H-T, regardless of income, that every American has the right to the best quality health care that the system can offer regardless of income, that if you're a low-income kid, you're a wealthy kid, you have the same opportunity to access the health care system. Do you believe that?
I believe that every person ought to get good health care, and the Hippocratic Oath says that I would provide health care regardless of whether the person pays me or not. So I definitely believe that people need health care. The question is, how do we do that?
Well, if I may, I'll give you a chance to respond. It's not, we all know people do need health care when they get sick, but is it a right? Should all people, regardless of income, have access to the same quality system, or should we have a 2-tier or 3-tier system, in your judgment?
If health care is a right, then so is food care and shelter care and clothing care. Food, clothing, and shelter, I think, are at least as important as health care, and yet we don't expect the government to provide food, clothing, and housing to everybody. So,
not to everybody, we don't, but we do have a food stamp program which does provide to low-income people.
When you call something a right, it's different to have a right, a freedom to act and to do what's best for one's family in a free America. It's another thing to have your rights impose obligations on other people. That's a whole different philosophy, and I'm not so sure that's what the Constitution guarantees.
Hey, let me ask you this, and I've gone on too long. I'm going to give it over to Senator Paul. Again, I applaud you for your free services and your volunteer efforts. But don't you think it's a little bit of apples to oranges to say that, you know, if somebody does something for nothing, obviously the cost is going to be lower than somebody who is paid. Physicians usually paid, nurses are paid, surgeons are paid. 2 questions. I mean, isn't that basically true? And second of all, it's one thing to run a primary health care free clinic, as important as that is. Somebody walks into your office, they're diagnosed with cancer. They have to go to a hospital for an extensive number of tests and treatments, which could run up tens of thousands of dollars. How does that person pay for that in a free clinic environment?
In the United States, you notice people aren't dying on the street. People are taking care of patients, and people are coming down with cancer, have no insurance, they're getting medical care. The hospitals absorb it, the oncologists take care of them for free. That's already being done. It's not as bad as it sounds. What we're suggesting, though, is what we have in this country is patients are taking on the liability of patients, or physicians are taking on the liability of taking care for patients who are not paying them, and yet the liability is huge. And that is why the whole idea of the malpractice cover in exchange for free care. I've spoken with physicians informally, and I've done internal polls. I'll send out an email, SurveyMonkey, and ask them, would you do this? Would you provide 4 hours a week of free care in a non-government free clinic where you just get no compensation? Every specialty says yes. They would do it in a heartbeat. I'm suggesting that neurosurgeons maybe do 2 cases a month, maybe an obstetrician do 2 deliveries a month for free, and that would account for their post-op time. And they all say that they would be happy to do that. And So we're talking no money. We're not going to, it's free. How can you argue with free? And it's universal access. How can you argue with that? It sounds like something on your side of the aisle.
Okay. Thanks very much. I've gone over my time, but it's in plus, and I'm going to give the mic over to Senator Paul.
Thank you very much. With regard to the idea of whether or not you have a right to health care, you have to realize what that implies. It's not an abstraction. I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery. It means that you're going to enslave not only me, but the janitor at my hospital, the person who cleans my office, the assistants who work in my office, the nurses. If you have a right to their services, basically, once you imply a belief in a right to someone's services, do you have a right to plumbing? Do you have a right to water? Do you have a right to food? You're basically saying that you believe in slavery. You're saying you believe in taking and extracting from another person. Our founding documents were very clear about this. You have a right to pursue happiness, but there's no guarantee of physical comfort. There's no guarantee of concrete items. In order to give something concrete or someone's surface, you've got to take it from someone. So there's an implied threat of force. If I'm a physician in your community and you say you have a right to health care, do you have a right to beat down my door with the police, escort me away, and force me to take care of you? That's ultimately what the right to free health care would be. If you believe in a right to health care, you're believing in basically the use of force to conscript someone to do your bidding. Now, just because it's a noble thing to believe that we are obligated as Christians, we are obligated through the Hippocratic Oath, we have always done this. Since the beginning of modern medicine, we have always provided 100% access. I do it in exchange for privileges. I do it because I believe in the Hippocratic Oath, but my hospital also says to me, you can only operate in this hospital if you agree to see everyone coming through the emergency room. I always have. We have always treated. We have always had 100% access through our emergency room. Those were for emergencies. They're not the best place for primary care. We all agree with that. But we've always had 100% free access.